A little bit about myself first. I was originally a psychiatric nurse, worked for many years in psychiatry, and then I became a patient of the same system. In fact, I became labeled a schizophrenic, and I spent 10 years as a totally given up upon schizophrenic on the highest disability with no possibilities of ever recovering. Fortunately for myself, I did find a way out. When I came out, I decided to become a psychologist, and I today work with people who are traditionally told now that they have no hope of recovery or any possibility of finding their life dreams, and probably going to spend most of their life in the psychiatric system. So I'm also an activist and yeah, many things. So I will be talking a little bit about this overdiagnosis, or perhaps diagnosis in general. Because why is it almost impossible to get rid of a schizophrenia diagnosis, and probably many other diagnoses at the same time? Primarily because there are two very different ways and perspectives of looking at this phenomenon. And I tried to outline it a little bit here. We have the dominant society, who has the power to define and the power to explain why and what is happening. And then you have the people who are actually involved in this, who view things somewhat differently, in fact, very differently. So life stories, meaning, context, culture, etc. are all very, very important, whereas psychiatry tends to have an illness paradigm. The interesting thing that's also very significant is that it's the only medical speciality that has a worldwide movement against it. And I think that's quite telling in some way. So what is these sort of differences? I'm going to try and look at it from both perspectives in terms of the overdiagnoses and where I end up here. Psychiatry today tends to be, now I apologize, I'm going to be rather black and white, but 20 minutes means that you can't really be that nuanced. And sometimes being black and white kind of makes a point. Psychiatry tends to be rather reductionistic in its way of looking at things. It puts the importance on experts, a technological framing of people's problems, and also places the problems inside the individual, tending to do this kind of through a biological explanation. So we could also talk about it as being a modern business based on the Age of Enlightenment. But I'm not a great fan of all these little mind map things, so I like to use my favorite one, which is the avocado and the onion. Psychiatry is the avocado, and the rest of the world is, well, I don't know, is the onion. We have what psychiatry believes in, which is it tends to try and find the ultimate truth, which is existing inside the pip, if you like. So it's removing all that is context, meaning, life stories, understanding the human psyche in the attempt to find this elusive thing, for example, schizophrenia or ADHD or whatever it may be. So these things are removed, and by the way, this tends to be the things that people who are labelled consider rather important, sort of in general anyway. So what many people believe, and including myself, is that there is no human psyche and psychology for that matter without some kind of context. Then we have the perspective from, for example, my perspective, which is the idea that psychosis or madness is absolutely connected to life story and tends to be connected through people's very difficult life stories. And this is just one. I tend to use that one too as well, explaining the dosage effective. In other words, the more trauma you have in your life, the more likely you're going to be psychotic and then probably end up with a diagnosis like myself. This connection has existed throughout all the research, constantly finding. In fact, people are saying they can't be bothered now to do any more research in terms of trauma and psychosis because the evidence is right there and continues to be there. But nevertheless, this is something that tends to be rather important to someone who's got labels. Also, the idea of people not wanting, going back to the original slide, but wanting these diagnoses, they tend to be rather stigmatizing, but they also have a pretty high risk of being chronic patient, not getting there. Your life expectancy tends to be considerably shortened, possibly. High youth mortality, and a life as a marginalized citizen. So that diagnosis is not usually very popular, which tends to be why there's a bit of a resistance against it, which usually means that you tend to have a, what do you call it, lack of illness insight, which is also a symptom. Then we have also research. Now this is a very recent one, which from this year, and this research we've known about for many years, but it says they've decided now that actually the antipsychotics do actually harm the brain. However, the conclusion here is we caution that the likelihood that antipsychotic medications are associated with thinner cortex in individuals with schizophrenia should by no means be interpreted as a contraindication for their use in treating patients with severe mental illnesses, including schizophrenia. Well, I'm not entirely sure what you think about having your brain shrunk in a treatment. You see, this does tend to make people not very enthusiastic. And the thing is that people do know about these things, which again creates this activism and resistance. This morning I looked at Lundbeck, pharmaceutical industry, and they put here, there exists no blood tests, brain scans, or any other kind of test that could be used to diagnose schizophrenia. So the doctor must therefore diagnose the illness based on symptoms of the patient. So this begins to make me think, you know, I question myself, are we we are over-diagnosing, there's no doubt about that, but what are we actually diagnosing? That's a good question to ask sometimes. So I tend to kind of look at it, the diagnosis, you know, as more of a social construction. Now, this does not mean that people do not suffer, because people do suffer. People suffer terribly. So, we have to always have to ask about whose truth is it? Who's the right truth? Which is quite an interesting situation here. Now, I have decided to read a little story about a woman called Pat, not her real name, but to try and illustrate these sort of differences here. So, Pat was a young 19-year-old woman who was sectioned in psychiatry because she attempted to commit suicide after being raped. Despite staff knowledge of the rape being the reason she tried to commit suicide, it was the focus on Pat's voices that took priority, resulting in her diagnosis of schizophrenia and the implementation of forced treatment and locked doors. Pat was forcibly injected with medication, and because she was never told why, other than it was for her own good, she said, and I quote, "I got more paranoid. I wouldn't eat. I wouldn't drink. I felt everything was poison, that people were trying to poison me, just because they never told me. I never understood what the drugs do or did. So I was so very sleepy, very sedated." Pat's behavior became increasingly unusual. She began to, for example, drink from puddles and lick windows. So from a psychiatric perspective, Pat's symptoms of bizarre and meaningless behavior reinforced the staff's belief that she has schizophrenia. And she has schizophrenia, why? Because she behaves in a bizarre and meaningless way. In other words, the staff are engaging in a psychiatric circular reasoning, and this form of circular reasoning is endemic in psychiatry and remains so because of the power structures in place. So in Pat's case, being framed and silenced in this manner resulted in her becoming a revolving door patient, spending years going in and out of psychiatry. On the surface, many would think fear of poison, starving oneself, hearing voices, and only drinking from puddles or licking windows could be classified as extreme behavior worthy of being called madness. And if one has this understanding of the world, that madness is diagnosable, biological phenomenon that can only be controlled through chemical means, and the laws are in place to make this perspective the right one, well then everything fits neatly into, as in Platt's case, the schizophrenia box, and we have both the solution and the answer. But what if there is another understanding, another perspective, connecting madness to lived life with all the complexities of human meaningfulness in the center? This creates space for understanding, not just for the persons in distress, but for those trying to help her. You see, Pat did not just carry a story of rape with her, she carried a history of extreme child abuse. Pat herself was a child born of rape, with the result that her mother treated her with great cruelty and violence. She was constantly beaten and berated for being the product of a rape. Now Pat is raped, and already there is a link. Do you see it? Pat's home had a room in the cellar for their coal, and from a very early age, her mother would lock Pat in there as punishment, sometimes for up to 2 whole days, with no food or water, often naked, and she would bury herself under the coal to keep warm, along with the bugs and other things that lived there too. There was a very small window, and sometimes there she could get a bit of water by licking the condensation off the window. If it had rained, it might seep in, so she could lick it off the windowsill. Do you hear a connection? Do you hear a connection forming already with her actions in psychiatry? In the coal cellar, hang on, I lost my place here. Oh, in the coal cellar, through the little window, she could see the moon at night, and the moon became her friend, whom she could talk to. The moon was fickle, however, because its moonbeams would point to where she could hide food that she smuggled in under her clothes. That is, until her mother found out and sent her in there naked. But being a child, she did not understand the movement of the world and the moon, so when she went to find food, it was not there anymore. Her voices that started in the coal cellar were, among others, the moon, who could both punish and comfort. When she was 7, they moved, and there was no coal cellar there, but her mother continued to derive new methods of horrendous punishments, and all the while her mother would tell her what a bad child she was, and that she was doing it for her own good. Do you hear another link? Since psychiatry's discourse silences Pat, while at the same time not proffering any explanation for their actions towards her, a gulf between realities is created, resulting in both parties thinking the other's actions are incomprehensible, and both create a narrative of understanding to account for the other's actions. However, it is psychiatry's dominant discourse and the laws that support this that becomes the established truth. And Pat's truth is obliterated as she is forced into the role of a schizophrenic. But because her reality is silenced, does not mean that it is gone. On the contrary, it is there, weaving itself into the dominant narrative created by psychiatry, where it is perceived as madness and justifying psychiatry as an enterprise. So what if meaning and understanding is introduced and madness can be placed in a context? Will that threaten to destabilize orthodox psychiatry as we know it? Or could it be a start of a more humane system of help? For Pat, after years as a revolving door patient, she met the Hearing Voices movement and first there found her voice, and with her fellow voice hearers and peers. And she is today out of the system, helping others find meaning and understanding. And like her, I'm also here today to try and introduce that there are many truths, many perspectives, and that diagnoses must be considered extremely carefully because they have extreme consequences. I, for example, when I met the psychiatrist when I got locked away, I remember he sat across from me and said, "Olga, you have schizophrenia." And I said, "No, I do not." And he said, "Yes, you do. And denying it is a part of your illness. And we will be, unfortunately, have to keep you in the hospital for a rather long time." And I spent the first 7 months in a closed ward. And during those 7 months, I lost everything that was of value for me. I lost my job, my studies, my friends, everything. Which means that you too also get a diagnosis of depression on top. So you stop the antidepressants and so on and so forth. But anyway, so I want to end this story of Pat here by quoting C.S. Lewis, where he says, "Of all the tyrannies, a tyranny sincerely exercised for the good of its victims may be the most oppressive. For those who torment us for our own good will torment us without end, for they do so with the approval of their own conscience." So, is it possible to get rid of my schizophrenia diagnosis? I'd say it's very, very difficult. For example, a couple of years ago, I broke my arm. And I went to the emergency and it was put in a plaster. And I was told to return a week later to get it checked when the swelling had gone down. So I go to the same hospital and I ask for the information. And I have my arm here and I say, "I need to have an x-ray done. Where do I go?" And the man looks up on his screen and he points. "It's down that way." And I say, "I'm sure." The woman said it was near the emergency. No, it's definitely down there. So off I walk. Where has he shown me? To the psychiatric emergency. So I tend to say that this is a diagnosis that does follow one, rather like a bad smell. It's a bit difficult to unstick. But also there's the question of, if you remove the label of schizophrenia, which is what I'm writing here, is they do profoundly actually challenge the scientific foundations upon which psychiatry is based on, and exposing it to questions that it has, for the most part, been very successful at avoiding. So I have not met anybody who has had their schizophrenia diagnosis removed. So it's a kind of one that you have to figure out manners and different ways of living with it to the best of one's ability. So I tend to use humour. It's usually quite a good way of doing that. So thank you very much. And,